when I treat older adults, sometimes I still have to work with them to help explain that depression is like any other medical illness, that it's like diabetes or it's like hypertension. It's something that we need to kind of screen for, and that it's not a moral failure or weakness. There's some wonderful tools out there to help people become aware of what depression is. And so one that I like to actually share with my patients is an instrument called the PHQ-9, and you can see in a very concrete way that depression is not one symptom, but it really is sort of a cluster of different symptoms. And I think that can be really helpful to patients as well as family members. The good news about depression is that we have some good treatments. We have medications that are effective for depression. A number of them we have a lot of experience with. Now, one of the interesting actually similarities between depression and anxiety is that a lot of the medications that effectively treat depression also treat anxiety.
There are also some non-medication interventions for both depression and anxiety that have been demonstrated to be effective for older adults. These include both individual and group therapy, cognitive mindfulness kinds of interventions that can ease the symptoms and improve their functional status.
There are also things that, for example, are good for brain health, can also be good for your mood. For example, physical exercise can really help with depression and anxiety. One of the things that's been shown to be quite effective is what's called mindfulness meditation. A very simple technique that can really help to reduce symptoms of anxiety and be, as powerful as medications and without many of the side effects. It can take time to really find the right amount of a medication or the right type of psychotherapy in order to get somebody better from depression. Once people are identified with depression, we don't stop with simply giving them a medication or maybe giving them a course of one kind of psychotherapy, but that we really actively sort of monitor their symptoms over time, and if things aren't getting better after a couple of months, that we really consider making a change.